I wanted to switch gears and ask you a few questions about your work with the WHO, looking into China and in particular the WHO's response to COVID-19. Last month you published a report about your findings, and it found that China could have done more in the early months of the outbreak, and the WHO could have labeled COVID a pandemic sooner. I'm wondering your thoughts, and I know it's an early juncture. Everyone's still very much focused on the pandemic and the onslaught of what has happened and what is happening. But is there a time in which you envision there should be a conversation about reform at the WHO?
I think it's clear we need a stronger, more empowered WHO where they can feel emboldened to speak truth to power and do what needs to be done at the earliest possible opportunity. And I think all member states need to reflect on how they support the WHO to do its job. The WHO is always having to look over its shoulder to think what will powerful member states think. It cannot do the job that it wants to do for global public health. I would add another component to the two areas you've already mentioned where we said there was slow response. We mentioned a third, and that's basically most countries on earth who acted too slowly in response to the WHO declaration of the public health emergency of international concern. We look at the month of February, which followed that declaration on 30 January. So few countries did so little, did very, very little. Most countries did very, very little. And that's when the pandemic got away. So, I think, cause for reflection by every member state, by WHO itself, as to why this got away. And we will provide an authoritative chronology on that and some recommendations for the future.
Okay, and I'll just, if you don't mind, follow up, because that is what I wanted to ask you about, because I very clearly remember that time and how even in this country, we were told the risk was low. It seems like there was a disconnect or a lag for that month of February, as you mentioned, and then a few weeks in March, and then all of a sudden everything changed. Your report, as you say, notices that was not endemic to just one country, that it happened all over. What is at the heart of that problem?
Look, it's almost incomprehensible to us as a panel, because public health emergency of international concern should trigger the highest level of alert. But I suspect it may have something to do with the fact that when SARS was declared, it was in a sense, the dog that never barked for most of the world. It was largely confined to East Asia. So I think also people saw Ebola, largely confined to the Democratic Republic of the Congo and West Africa. Zika, didn't reach Canada, presumably in any great numbers. So we've got a bit blasé. And what this tells us is being blasé is fatal. The United States just passed the 500,000 dead milestone, a terrible, terrible tragedy. So, wake up call. When the WHO declares, you move. You don't sit around and think, oh, well, that'll stay in China, that'll stay in East Asia, whatever. It won't. We are globally interconnected. And that is the huge difference between now and 2003 and SARS. In 2003, there were not 9 plane loads of people from China coming to little New Zealand a day. It's not going to stay in any one place where it originates if it's a novel pathogen which is highly infectious like this. So get real. These are real threats. This won't be the last of them. And if we don't seize this opportunity, what I call the Chernobyl moment for global health, to make fundamental reforms, then we're doomed to repeat these tragic lessons of history.
Okay, Ms. Clark, I'll leave it there. I do appreciate you making the time for us today. Thank you.
Thank you.
Helen Clark is, of course, the former Prime Minister of New Zealand, also chair of the Global Commission on Drug Policy. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.